attendants are known to get more breast cancers and melanoma. They also seem to have more uterine, gastrointestinal, non-melanoma skin cancers. Sleep deprivation, time zone changes and exposure to chemicals may be to blame. Women with 3 or more children are already probably not getting enough sleep, Mordjukovic said. Combine that with this disruption from the job, especially for those who fly internationally, this may be an indication that the circadian rhythm disruption is having an impact. Disruptions in circadian rhythm, a person's daily sleep-wake cycle, are linked to an increased cancer risk, studies have shown. The new study compared data on self-reported cancer cases in the Harvard Flight Attendant Health Study, which collects data to help people understand how their job can affect health, with cases tracked in the U.S. Centers for Disease Control and Prevention's National Health and Nutrition Examination Survey, an ongoing study that tracks the health and nutrition of adults and children in the general population. 80% of the flight attendants in the study were women, as would be expected, the authors said, in a feminized occupation. The research does not answer why flight attendants report higher cancer numbers, but the authors have some ideas. Based on earlier research, flight attendants are often exposed to possible or probable carcinogens like pesticides, fire retardants, jet fuel and other chemicals more frequently than the general population. They are also exposed to higher levels of cosmic ionizing radiation. The World Health Organization says this is a cancer risk. If you fly a lot, should you worry about your own cancer risk? Mordjukovic said there isn't a lot of research on frequent flyers, although logic suggests that they face similar exposures. Independently, NASA scientists have studied high-altitude radiation to help improve monitoring for aviation industry crew and passengers. Steve Firing, a professor of microbiology and immunology at the Geisel School of Medicine at Dartmouth, said it's hard to argue with the idea behind the recent study. Firing, who was not involved in the study but conducts research on flight attendants, said he found the high rates of melanoma and non-melanoma skin cancer among women in the study striking, especially to see a close to 4-fold increase in non-melanoma skin cancer. That is substantial, he said. Mordjukovic said she and her colleagues were motivated to study flight attendants because there are gaps in the research on them, and that could mean gaps in the policies meant to protect them on the job, at least in the United States. In Europe, flight attendants' exposure to cosmic ionizing radiation is monitored and limited more by law. There are no official dose limits for American aircrew. In fact, it wasn't until 2014 that U.S. flight attendants got protections from the Occupational Safety and Health Administration like other American workers. But even today, those protections are limited, Mordjukovic said. Our goal with this is to do the science and provide more evidence for policymakers about this profession's health, Mordjukovic said. We hope this helps.